In this video, we will discuss the clinicals of development of the ear, and the first one is minor auricular malformation, which are due to Down syndrome, trisomy 21, Peteau syndrome, which is this is due to the defect in the chromosome number 13, and the Edward syndrome is due to the defect in the chromosome 18. And what minor auricular malformation are? Variation in the auricle. Then second one is low set slanted auricle. These are because of these three syndrome: Down syndrome, Peteau and Edward syndrome. And low set slanted auricle means normal ears are at the plane that joins the eye with the eye and the occiput bone. If that plane is if the ear is not at that specific point, then it is known as low set slanted ears, and these are low set ears and posteriorly rotated. Auricular appendages are the skin tags that are present in pretracheal area. Congenital deafness is due to the damage of the organ of Coti during the 7 and 8 week because of rubella infection. Microtia is a defective fusion of the auricle hillux, and it is associated with the deafness. Congenital cholesteatoma is a benign tumor of the middle ear. It cause congenital conduction deafness. And preauricular sinus. What is preauricular sinus? Is a narrow tube that has opening on the interior aspact of the external opening. It is asymptomatic, but if got infected, then it is symptomatic. Atresia of the external auditory meatus. This is of two types: complete and the partial. Complete is it has bony plate instead of the tympanic membrane, and in the case of partial, it has soft tissue in front, not in front, soft tissues in place of tympanic membrane, and it is associated with conduction deafness, and it is mainly associated with the first arch syndrome. Thank you.